Alexia, my name is Angela. This is part two of our head to toe assessment, okay? We will go ahead and resume our part two of this, the head to toe assessment. Like I said earlier, I will actually inform you of what areas I will be touching, listening, and I would just ask that you would actually inform me if there's any tenderness, and then I will stop the assessment, okay? Okay, so what I'm going to do now is I'm going to actually start off with your thoracic area, okay? Your thorax, okay? So this is the upper portion of your body right here. I'm just going to ask that you turn to the side. Okay, and what I'm going to be doing, Alexia, is I'm going to actually be inspecting first. I'm going to inspect your posterior part of your thorax area. Okay, I don't see any abnormal findings. Okay. Now what I'm going to do is I'm going to percuss, okay? So I'm going to actually go ahead and I'm going to percuss this area right here. If you can turn. Okay. Okay. Now what I'm going to do, Alexia, is I'm going to actually be checking for your CVA tenderness, okay? I'm going to be palpating your kidneys. Just let me know if you feel any tenderness, okay? You feel any tenderness?
No.
Okay. Now I'm going to be listening to your breath sounds, okay? I'm just going to ask that you take a deep breath in through your nose, out through your mouth, okay? Okay, your breath sounds are clear and equal in all lung base fields. You can turn to the front now. I'm going to actually be inspecting your anterior portion of your chest, okay? Okay, and it is flat. Okay. All right. Okay. So what I'm going to be doing now is I'm going to be listening to your breath sounds as well, okay? Take a deep breath for me. Okay. Okay. Thank you, Alexia. I'm going to be inspecting your trachea, okay? Your trachea is right here, and I'm just checking. Make sure it is midline. It is midline, and I do feel the rings. No deviation. Okay, you feel any tenderness?
No.
Okay, all right, Alexia. Now, Alexia, while I was actually assessing your neck, I did want to also assess your thyroid gland. So if you could please swallow for me. Okay, and I did feel your thyroid gland move up and down. Okay, and there's no tenderness to your thyroid gland?
No.
Very good. Okay, Alexia, now what I'm going to do is I'm going to actually be checking your heart, okay? So what I'm going to be doing now is I'm going to actually be listening to your heart sounds, okay? Okay, so now I'm going to actually start off with your heart sounds. It's your aortic, pulmonic, mid-precordial, your tricuspid, and your mitral. Okay, it is regular. Now what I'm going to ask you to do is stand for me, Alexia, and we're going to actually go and we're going to sit here, okay? Okay, now I would like to actually listen to your heart sounds on a supine position, and that is lying flat. Okay. Okay, your aortic, your pulmonic, your mid-precordial, tricuspid, and your mitral. Okay, now what I would like for you to do is turn to your side. Okay. Turn some more. Let's see right here. Okay. And I'm going to be checking on your lateral. Okay. Pulmonic. Your mid precordial. Your tricuspid. And your mitral. Okay, very good. Okay, Alexi, if you can turn back on your back for me. Okay, now what I'm going to do, Alexi, is I'm going to be inspecting your abdomen. Okay, so that's your stomach area, okay? I'm just inspecting it. Okay. It is flat. Your skin is warm and dry to touch. Okay, your umbilicus is inverted. Okay, now what I'm going to do is I'm actually going to be percussing, okay? So I'm going to actually be percussing, and then I'm going to actually palpate, okay? Okay. Okay, now I'm going to palpate. I'm going to actually just be doing some deep and some light palpation, so I'm just actually going to be touching. Just let me know if there's any tenderness, okay? You feel any tenderness?
No.
Okay. All right. I'm going to be listening to your bowel sounds. Your bowel sounds are active in all 4 quads, okay? Now I'm going to be listening to your vascular sounds, okay? I'm going to listen to your aortic. Your renal arteries. Your iliac. And your femoral. Okay, let's see if you could please sit up for me. Now what I'm going to do, Alexi, is I'm going to be checking your lower extremities and your upper extremities, okay? So I'm going to begin with checking your lower extremities first. I do see that you have some hairs on your legs, and they are evenly distributed. Your skin is dry. I don't see any lesions, no swelling noted, okay? Okay, if you could please just push my hand. Checking your muscle strength. You have a strong muscle strength. You could just please move your legs, checking your range of motion. Okay, very good. Okay, now I'm going to go ahead and I'm going to be checking your pulses, okay? Your femoral. Your popliteal. Posterior tibia. And your dorsal pedia. Okay. Now what I'm going to do, Alexi, is I'm going to be checking your upper extremities, okay? If you could please, I'm checking your muscle strength. You can just please push my hands for me. Okay. You have a strong. And now I need you to do range of motion for me. Okay. Very good. Okay. Now, Alexia, what I'm going to be doing is I'm going to actually be checking, it's called a Romberg test, okay? I'm going to ask that you would stand and I'm going to check to see if you sway. And this is a neurological test, okay? To just see if you sway or what have, or if you prone to falls or something, okay? So I'm asking that you would stand at this time, okay? You would close your eyes, okay? Okay. No swaying noted. Okay, you can open your eyes for me. Okay, and you can have a seat. Now, next what I would like to do, Alexia, is I would like to check for scoliosis, okay? And that is a musculoskeletal assessment. So what I'm gonna need you to do is I'm gonna ask you to stand, and I'm gonna ask you that you would bend, curve your back, and I'm going to be checking your spinal curvature, okay? So if you would stand for me, and this way, and just bend over. Okay, I'm just checking your spinal curvature, okay? Okay, and so your midline. Okay, and there's no curvature. If you could please stand for me. Okay, and one more last thing I need to check, Alexia, if you can please sit for me right there, is I'm going to check your patella reflex, okay? So I'm just going to be checking your reflexes in your knees, okay? If you can let your, just relax your feet, okay? And I'm just going to hit this on your patella, and that's your kneecap, okay? Okay, very good. Okay, Alexia, so this concludes our part 2 of our head to toe assessment. Did you have any questions or concerns?
No.
Does anything hurt?
No.
Okay, Alexia, I thank you for this assessment. Okay, and if you could please have a seat right here. Okay, so this concludes our head to toe assessment of Alexia. I will report off to my nurse that I have a 12-year-old female who's alert, awake, oriented, ×3. I did perform a head-to-toe assessment on her. I did assess her head, her eyes, her neck, her throat, her oral cavity. I did assess her upper chest, the thorax area, her lungs, her abdomen, her lower and upper extremities. I also assessed her for scoliosis, and I also assessed her Romberg, performed a Romberg test on her as well. I did not find any abnormal findings. Her skin was intact, no swelling. Should I have found any abnormal findings on Alexia, I would have performed a focus assessment. Alexia's speech was clear. Alexia appears to be have a good appetite, and also Alexia was she had a pleasant mood. I thank you all for this head to toe assessment.